Now, I give the floor to Daryl Pritchard, is the Senior Vice President of Science Policy at the Personalized Medicine Coalition, where he leads PMC's effort to increase awareness and understanding of personal medicine, identify address barrier to the adoption of personal medicine to the healthcare system, and develop and promote appropriate clinical healthcare infrastructure, regulatory and payment policies that will help advance patient-centered personalized healthcare. The Personal Medicine Coalition, representing collaboration of more than 250 organizations across various stakeholder groups, including innovators, scientists, patients, providers, and payers, promote the understanding and adoption of personalized medicine concepts, services, and products to benefit patients and the health system. Believing the paradigm shift, especially in medicine, that don't happen not just because the science and new technologies suggest they should. PMC support investment in the end adoption of personal medicine through educational, advocacy, evidence development, and healthcare delivery implementation strategy. I give the floor to Daryl Pritchard.
Hello, my name is Daryl Pritchard. I'm the Senior Vice President for Science Policy at the Personalized Medicine Coalition, based in Washington, D.C. in the United States. Myself, along with my colleagues, Dr. Edward Abrahams, President of the PMC, Cynthia Benz, Senior Vice President, Public Policy, and Chris Wells, Vice President, Public Affairs, have put together this presentation for the ICPerMed Conference 2021, entitled The Personalized Medicine Coalition, Developing Strategies for the Integration of Personalized Medicine in Healthcare Practice. Now, the ICPerMed Conference 2021 was originally to be scheduled in Paris, and I would like to thank the ICPerMed organizers for including the Personalized Medicine Coalition in today's agenda. And I'd also like to thank the international personalized medicine community, all of those who are attending today's conference, for all the work that we do together to advance personalized medicine. Well, I was supposed to be in Paris this morning, but unfortunately, like all the rest of us, I'm at home attending this conference and presenting to you from my home office in Alexandria, Virginia. But I really, truly appreciate the technological advances that allow us all to be together virtually for this conference. And just to make it a little bit more like I'm in Paris, I got myself a croissant and a French latte for this morning. It's 7:15 a.m. on the East Coast of the United States. So I will have those and at least imagine that I'm with you all in Paris. It's been wonderful to be recognized by the ICPerMed in this Best Practice in Personalized Medicine Recognition 2020 for the Personalized Medicine Coalition. The Personalized Medicine Coalition is an education and advocacy organization based in Washington, D.C. in the United States, representing innovators, scientists, patients, providers, and payers. We promote the understanding and adoption of personalized medicine concepts, services, and products to benefit patients and health systems. We're a membership organization with over 230 members of all different stakeholder types: industry, representatives, payers, providers, patients, and policy developers, thereby representing the entire personalized medicine community. Our mission is to advance personalized medicine, believing that paradigm shifts, especially in medicine, do not happen just because the science and new technology suggest they should. PMC supports investment in and adoption of personalized medicine through education, advocacy, and evidence development, thereby driving healthcare delivery implementation strategies. Now, personalized medicine certainly is coming of age. When evaluating personalized medicines, PMC categorizes those therapeutic products for which the drug label or its use in established clinical guidelines includes a reference to specific biological markers, often identified by diagnostics, that help guide decisions and/or procedures for their use in individual patients. In 2008, we classified only 5 such treatments as personalized medicines. But by the end of 2020, nearly 300 personalized medicines were available in the marketplace. Thereby, the number of personalized medicines has increased steadily over the last 10 or more years. Per the PMC's mission, a key objective is to educate decision makers and the public about personalized medicine, its value over the traditional one-size-fits-all model of healthcare delivery. An example has been given to us on the value of personalized medicine through this global pandemic. Scientists have begun to observe that we are in a better position to combat the devastating effects of the SARS-CoV-2 virus if we understood the molecular reasons why certain patients are more vulnerable to infections or life-threatening symptoms than others. PMC's education efforts include a number of field-defining publications and initiatives. Our flagship Personalized Medicine report, which provides a defining definition of the field, and our monthly Personalized Medicine Today and quarterly Personalized Medicine in Brief newsletters. Our efforts do not just target scientists, clinicians, and policymakers. We also have a public awareness campaign. PMC is conducting a campaign to improve patient awareness entitled More Than a Number, a patient-focused educational campaign about personalized medicine and its benefits, where we discuss how patients can inquire about personalized medicine with their physicians and approach their lifelong health care with a personalized medicine perspective. To help facilitate the development of personalized medicine tests and therapies, PMC also advocates for continued investments in biomedical research, as well as modernized regulatory coverage and payment policies that support access to personalized medicine. Our efforts include advocacy to the US executive branch, which has authority to advance personalized medicine by providing funding and support for personalized medicine research and clinical adoption, has authority for modernizing regulatory policies and coverage and payment policies, and supporting international efforts in personalized medicine. While our education portfolio is truly global, our focus in advocacy on the international community involves harmonizing regulatory processes and data management. We also advocate for the US legislature through the creation of a personalized medicine congressional caucus. The members of this caucus are committed to ensuring that healthcare policies in the US encourage decision makers to collaborate with patients in pursuit of prevention and treatment plans that are tailored more closely to patients' biological characteristics, circumstances, and values. Our third area of focus is our evidence development portfolio. That is policy research programs and initiatives meant to inform PM decision-making and clinical implementation. One key area of our policy research involves evaluating progress in healthcare. This research is designed to examine trends in personalized medicine and to evaluate progress in healthcare that can inform further advancement of the field. An example of this is our landscape analysis project, where we conducted an analysis of the integration of personalized medicine into US healthcare systems. We developed a personalized medicine adoption evaluation approach in 5 clinical areas, including oncology, rare and undiagnosed diseases, pharmacogenomics, prenatal screening, and healthy patient screening. This was based on a multifactorial personalized medicine adoption model. We developed an institutional level personalized medicine adoption rating between 1 through 5. And we surveyed 136 clinical care delivery institutions representing all types of institutions in the US, rural versus urban, academic health centers versus community hospital systems. We show here the distribution of overall level of personalized medicine integration. Now, most organizations were levels 2 or 3, which we felt was a good result. It shows that personalized medicine is being adopted at least at some level by most institutions. Very few ranked 1. But we need to move all of our institutions to a rating of 4 or 5 in order for personalized medicine to truly become the standard in practice. We can look at the multifactorial personalized medicine adoption model to develop strategies to do just that. Another area of research involves assessing clinical and economic value of personalized medicine. These studies are designed to assess the clinical and economic value of personalized medicine in clinical care and will advance evidence necessary to help payers and providers make decisions related to providing access to personalized medicine. An example of this type of research is our evaluating the clinical and economic value of next generation sequencing-based diagnostic testing for patients with cancer. And we focused on non-small cell lung cancer because that's where we have the most data. Our study used real-world evidence, practice-based data that showed a small but statistically insignificant improvement in clinical outcomes for those who had a sequencing-based approach to testing compared to the standard of care, single gene testing or no testing at all. And we showed moderate cost effectiveness associated with this strategy. But we also found a key practice gap. This data really unveiled a problem that is mitigating the value of the genomic strategy. And that is that 30% of patients with actionable mutations, as determined by the next-gen sequencing, still did not get a targeted therapy. Since this was a model, we were able to assume what would happen if all patients with an actionable mutation were in fact able to get the best treatment option for themselves. And in this case, the cost effectiveness of this approach would improve significantly. This also sets up future research which can examine the personalized medicine practice gaps. A third area of research involves examining clinical integration strategies. PMC's efforts in integration can help providers to better understand challenges related to the use of personalized medicine technologies and services in clinical practice and help generate broad strategies and potential best practices for addressing those challenges. What we're trying to do in a nutshell is to develop a roadmap that leads to the evolution of healthcare delivery to a system based on personalized medicine. The roadmap for integration of personalized medicine is a work in progress. We've developed a report on the strategies for integrating personalized medicine into healthcare practice for clinicians and providers. Also, an overview document of the integration initiative for all audiences. And we've put together a patient-focused report on moving beyond population averages, a patient-centered research agenda enhancing personalized medicine with patients and research as the target audience. And finally, we have several case examples that can be used by other institutions that are considering implementing personalized medicine strategies to help see what has been challenging and what has been a success within institutions that have developed personalized medicine programs. Some new initiatives in the area of clinical implementation for 2021 include addressing practice gaps in the implementation of personalized medicine in cancer care, addressing disparities and health equity in research that advances personalized medicine, and addressing challenges in using health data to advance personalized medicine. In conclusion, I'll leave you with a quote from Machiavelli, which exemplifies our challenge, all of us who are committed to advancing personalized medicine, all of the ICPerMed conference attendees. Machiavelli said, "There is nothing more difficult than to take the lead in the introduction of a new order of things. For the reformer has enemies in all those who profit by the old order, and only lukewarm defenders in all those who would profit by the new order. Why is support for personalized medicine only lukewarm? Because mankind does not truly believe in anything new until they have had actual experience of it. At the Personalized Medicine Coalition, we set out to ensure that all see the evidence of personalized medicine's value. So here is my website address and my email address for those that want to reach out or engage further after this presentation, and I look forward to questions and answers. Thank you all.
Thank you, Daryl, on this presentation that explain a very relevant issue of the personal medicine that were one of the principal goal of the ICPerMed in order to find solution in the real opportunity for the patient in the use of the personal medicine.